NAHU members preventing healthcare workers and also patients from getting medication.
Public sector unions slamming government's latest wage.
This is where NAHU, the workers' union, has embarked on its nationwide strike.
Major focus has been on disrupting health services.
The past couple of months have been quite rough, with rolling blackouts, corruption and political instability. But it doesn't end there. On the 6th of March, NAHU members went on a public service strike. The health sector was hardest hit. 6 people died.
When the NAHU strike turned violent, it's part of a toxic broth that is simmering in our country and that is looking for outlets, and the strike gave it an outlet.
Mark Haywood is a South African human rights and social justice activist. He feels there is no justification for violence.
NAHU could have targeted it at the offices of provincial health departments, but to deliberately impede services and cause that type of disruption, I feel was immoral as well as unlawful.
It has put the risk of those who already have their lives compromised by illness and disease. Now services are being withheld from them.
Dr. 𝗶𝗵𝗶𝘀 Mahlati is Deputy Director General in the Department of Health, responsible for hospital services nationally.
The major focus has been in hospitals that are serving disadvantaged black communities. We just do not understand, as to what went into the planning and thinking and all that of those who orchestrated the strike.
The strain on our nurses and doctors has been growing, and yet what we're talking about is a constitutionally enshrined right, the right of everyone to have access to healthcare services. The budget for the healthcare system has been declining for a decade.
You can't have a shrinking tax base and then think that you'll be able to provide for every demand in society. Therefore, we've got to look at how do we grow our economy. And I can assure you, even if government were to give that 10% now, next year they'll be demanding 20% and go on strike.
Do we know how many lives have been lost?
So far, the reported lives that are linked to the strike are 6. However, it is highly possible that it's not only 6, it could be more than those.
Carte Blanche requested an interview with NAHU, but they declined.
The nastiness and violence that we saw in the healthcare workers' strike should be taken as a warning of a nastiness and a violence and a lack of respect for rule of law that could take place on a far larger scale should the paws of this country decide that actually we have no stake in this system in the way that it's running at the moment. And we're getting close to that point.
It's undeniable that South Africans have had enough. With all the broken promises, people are now choosing to go to the streets. And with the looming EFF national shutdown, how much more can we take?
I haven't given up hope. The strike also showed us another side, that there were many nurses with many doctors who continued to go to work despite the threats and the violence and the intimidation. And I still think that that is the heart of our country. That's what gave us 1994. That's what helped us to avoid a civil war. We have the resources, I think that we have the people, and we still have the vision. We just have to find a way to put those 3 things together effectively.